Hi, my name is Andrew Calvin. I'm an assistant professor of medicine at Mayo Clinic, and I'm here at the American Heart Association talking about some of the research that we've done recently. In our study, we enrolled healthy, relatively young individuals and studied them in a laboratory-based environment to answer the question, what happens to energy consumption and what happens to energy expenditure when people are forced to reduce the amount of sleep that they get. So in our study, we took healthy young individuals and reduced the amount of sleep that they got by about 1/3. So most of the people ended up going from about 8 hours per night down to somewhere in the 5-hour per night range of sleep. And over this 8-night period, we found that people increased the amount of caloric intake by about 550 calories per day. Meanwhile, those who were allowed to sleep normally showed really no change in their caloric intake. At the same time, we measured how much energy they expended through movement. Energy expenditure was measured by a physical activity monitoring system, which consisted of special undergarments which had accelerometers built into them. Through these series of accelerometers, we were able to tell exactly how much people were moving throughout the day, and indeed across the entire 24-hour spectrum. And we found that really the amount of energy that people expended really did not change at all. So it suggests that the 550 extra calories they consume directly translate into a net increase in caloric intake, and probably, if this would go on indefinitely, would lead to an increase in obesity. As a secondary aim, we looked at some of the hormones involved in appetite and satiety. And what we found, contrary to other studies, is that we really didn't see any change in these two hormones, leptin and ghrelin, which would be, and if anything, we saw a trend in the opposite direction compared to what some previous studies have found, which suggests that what we were seeing in these minor hormonal changes were probably the result of increased adiposity, that is, increased fat mass, rather than anything else. So in conclusion, we found that 8 nights of really modest sleep restriction was associated with a striking increase in caloric intake and no change in energy expenditure. This implies that if people are doing this to themselves on a regular basis, that this might be a powerful factor contributing to the obesity epidemic.